Dr. Oz is back again to answer some of the interesting medical questions from our viewers. Now, the questions that came to our website are all anonymous because some of the emails are pretty personal. So we'll start with this first email, which is very personal. It says, what is the cause of grossly enlarged male testicles? A friend has this condition.
Of course, a friend, not me.
He would like to see a doctor, but doesn't know what questions to ask. He had prostate surgery 5 years ago.
So big issues that cause testicular swelling include swelling by lymph. Lymph is the waste product of the body, and so that gets thrown away sometimes, but it gets stuck sometimes in tissue as well. Also, if you get just one side of the testicles being large and the other is normal, you have to worry about something called a varicocele, which means the veins are blocked off. That's a big issue because it causes impotence, because the testes are hanging outside the body because they need to be cold.
Right.
And if they're not cool enough because the veins are surrounding them, they'll let you kill off the sperm. You listen, examining your testicles, we joke about this a lot. The reason I did it on Jimmy Kimmel was because it is the #1 cause of cancer death in young men. You can save a lot of lives by getting men to examine their testicles. It's not comfortable. Women don't like examining their breasts either, but it works.
Well, and for a man, I mean, going to a doctor and asking about that, the doctor's seen it all before, right?
That's exactly right. I'm always sort of surprised on the show. People ask the most embarrassing questions, but they don't ask it in the privacy of their own doctor's office. And the reason, I think, is because they realize that many people benefit from asking questions that you probably heard when you were 5.
Yeah.
Or maybe you don't remember it anymore, or maybe your mom had it wrong. So, you know, we talk about poop and urine and testicle exams and trying to figure out what those things coming out of your body are, because you learn from that a lot.
Better to hear from the family doctor than the coroner.
Exactly.
There you go. All right, we have some video questions too. Here's our first one. Take a look.
I am a vegetarian, and I would like to know if protein from legumes is comparable to protein from meat products.
The answer is absolutely yes. Protein from vegetables is actually just equivalent to meat products. Remember, cows don't eat meat, do they? But they have meat on them. And so what you really want to do is get as much protein as you can in your body, within reason, about a third of your diet, but without getting the saturated fats. Now, in the olden days, when cows and chickens all were raised on a range, they would get actually healthy nutrients into them, so they'd have healthy amounts of those nutrients in their meat. We don't have that situation right now, so I think the best place to get most of your protein, and we have evidence that people who eat a lot of protein from vegetables live longer. I'd go that route.
Now, I know we have a question from our audience. What's your question for Dr. Oz?
Hi, Dr. Oz. The government recently released some new recommendations that suggest that women don't necessarily need mammograms every year, ages 40 to 49. And Susan G. Komen for The Cure disagrees and still recommends that women get mammograms every year starting at age 40. And I'm just wondering what your thoughts are on those new regulations.
A lot of controversy this year over this issue. The Komen Foundation is a wonderful group. Many women advocacy groups came out in favor of continuing the old guidelines, which are maintaining mammography starting at age 40, unless you have risk factors, in which case you get it even earlier. Here's the story. It really depends on you. What these recommendations were all about was giving you an idea of how many people had to have mammography to save a life. And the reality is that mammography is not a great study. It works reasonably well. It's the best we have, but it's not great, especially in women who are premenopausal. The breast is thick. The mammography doesn't see through the breast so well. So if you're doing all the things right in your life and you don't have a lot of risk factors, I'm okay with not getting a mammography until age 50. If you want to get it earlier, please go ahead. It is the best test we have. Certainly if you have risk factors in your life, start at age 40. I don't want to take a government panel observations and try to turn it into law. We need to customize it for ourselves. Thanks for the question.
I want to do like a little lightning round of just one word, one phrase. Get your quick response. All right. Wine, alcohol, booze.
90% of the benefit of wine is the alcohol. Without question, it prolongs longevity. Partly because it builds community. You can't have alcohol at breakfast. We're talking about doing with people that you care and love for. And 90% of the benefit of, as I mentioned, of wine is the alcohol, but 10% is the resveratrol, that pigment that prolongs the ability of our cells to live, which is why a glass of red wine for women and 2 for men a day is not a bad idea.
Oprah.
I love her. The best. Authentic, real, and very, very honorable.
Chocolate.
Love it if it's real. It's got to be 70% cocoa or better chocolate. You know, the milk chocolate is milk fats and coloring and all kinds of other junk. You don't want that. Get 70% real chocolate. It's actually a health food. It's got flavonoids, dilates up your arteries. It's a snack that I love.
Medical marijuana.
Plays a wonderful role helping people who are desperately suffering from some illnesses, for example, nausea from cancer or treatment for cancer. We are way overusing it, and I'm very concerned that if we take a good idea, helping people in pain with a medication that works for them, and we pervert it by using it for recreational purposes, then we're doing a great disservice to everybody.
Fad diets.
They don't work. 98% or more will fail within 6 months. You hurt yourself by getting on them. Get on a lifestyle program. Listen, the reality, Dave, is that people who are thin think fat people are lazy lugs, right? And fat people think thin people are lucky devils. But the truth is in between. If you take a lifestyle approach that you can do every day, you don't even realize you're on it anymore, you will naturally seep back towards your playing weight, the weight you were when you were 18 years of age.
You have been such a great guest, so informative. Remind folks that you have your own show here, right here on KATU at 3 p.m. And also, we're going to link our website to your website, so if people have any questions, they can check that out.
Now, Dave promised me the last word you'd see on the show was sex.
Sex.
We'll be back.
How much?
Thank you.